Great. All right. In respect of everyone's time, it's 5, so we'll go ahead and get started. If we could please stand for the Pledge of Allegiance. At this time, I'm going to turn the floor over to Dr. Todd. She has an announcement.
All right, can you hear me? Are we good? All right. So I let Joni know in the group that this is my last board meeting. I'm actually resigning from the board effective tomorrow so that I could get through today. And I'm actually moving out of state for a position, so I will be leaving the community. But I didn't want to leave without saying how much I appreciated the opportunity to do it. I know I kind of had 2 hitches at it. And the first one was during COVID, and so watching you all work, that process and that difficult time, and watching the grace and the professionalism and the skill, I got to come in and observe some COVID meetings, tracing meetings, and just all the work. And since then, I've also had the opportunity to shadow several of you in your roles, and I'm just not sure the community understands the impact that you're having on the public health in this community. And so I just give you full credit and say, keep up the good work. It's, those of us who really pay attention, it's truly appreciated for the work you do, the dedication, Jody and her team. You've got some real long-term employees here that are just really knocking it out every day to make Vigo County healthy. So wanted to say appreciate that. Good luck to everybody. Joni has my information. If anything comes up in the future, Terre Haute's my home and will always be my home, even if I'm going to drift away for a little bit. So thank you.
Thank you, Dr. Todd. We will miss you greatly. All right. Robin? That's okay.
Okay. Dr. Amber Caddick,
Present.
Mark Kyleman,
Present.
Dr. Lim, Jeff DePass, James McKenna,
Present.
Dr. Jennifer Todd,
Present.
and Dr. Micah Thompson.
All right. Great. Minutes from the last meeting. Did everyone have a chance to review those? Any questions or concerns regarding those?
Second.
All those in favor? Opposed? All right, motion passes. All right, Robin, financial report.
Okay, you'll see in front of you our new chart of accounts. I kind of changed it up a little bit with the collar, just, it's not so colorful, but just plain and simple. If you have any questions, we're doing our spend down, getting ready to do our spend down, so we've got all of the beginning and imbalances on there, so we assessed our needs, what we're needing in our spend down. Any questions?
All right, thank you, Robin.
You're welcome.
Joni, I don't know if you have Dr. Brookins' report? Or...
I don't.
Okay, find them. Right. So your report?
Okay, well, once again, I was a 4-H judge at the fair for miscellaneous foods. I'm still participating in my NSHO Board of Directors meeting once a month. I'm on the statewide board and then the actual board. Brendan Kearns, the director of Vigo County Soil and Water Conservation, offered up boat rides to department heads on the Wabash to observe the bank erosion and Asian carp invasion. On a 90-degree day plus, in July, I took him up on the offer. The boat engine died about halfway from the Fairbanks Park launching dock to 63. We had to paddle over to the bank for shade and call on help to tow us back. It truly was a fun adventure. Still participating on the HFI core leadership team, Brandon Halleck, David Thompson, which is council president, and Mark Klinkenbeard, commissioner president. We met to discuss the usage of opioid settlement dollars, and that did pass through the county council last month, so He'll have a matching grant of $100,000 plus the matching money from the opioid settlement. Still attending the quarterly meetings at the jail that includes the sheriff, jail commander and matron, community corrections, judges, public defenders, Molly Collette, Dave Frederick, which is the jail counsel. And the mayor has started having warming shelter meetings and with county and city officials along with vested entities to look at how we could better coordinate our efforts. So that's a big part of what I've been doing. Any questions, any input? Thank you.
Thank you, Jen. All right. So any new business we have that our upcoming minutes, our meetings are January 21st, April 15th, July 15th, and October 21st. And is there any other new business?
That's actually an action
Oh,
item,
that's
but
an
you have to
action item.
squeeze the lemon juice on it
Oh,
and
I'm
then it
sorry.
appears in red.
So do we need to vote to approve those dates?
Yes.
Okay.
I'll make a motion to approve the dates as written for 2026.
All those in favor? Opposed? All right, motion passes. All right, now, any other new business? Old business, we have the proposed budget status update.
Everything passed and we did not have a substantial amount of cuts from our 2025 budget. But we haven't asked for any increases in about 5 years. Part of that is because we have been able to offset costs with external funding, but it's still good to know that we can stay within our budget and we do a great job spending it down.
Is there any movement for salary increases? I know that's been a point of contention for a while.
I don't, as far as I know, there's still discussion, but it's looking at what we can sustain and trying to assess the implications of SEA 1 and the impact that it's going to have on us locally at all the different levels, libraries, schools, city and county government. And I think that that's what's being taken into consideration. It would be hard to put something out and then say we have to take it back because we can't afford it. But I know that there'll be a lot of a good thought process into it, and they'll create whatever is most fair for everybody. And that is their goal, is to raise up our salaries. Because as some of you may not know, we work at a quarter of what we're supposed to be paid. And they're trying to get us to mid-range.
Any other questions? All right, standards for public health swimming pool facility, Amanda.
We'll just go ahead and do B and C. You guys voted on it. We put it in front of the commissioners. They voted on it. We advertised and it's been implemented, so we've updated our website and everything's good to go.
Wonderful. All right, and then that's for the fee collection ordinance
Mhm.
too? Okay.
Both of them.
Wonderful, great. All right, so since you're standing there, would you like to give us a program?
Sure. Okay, as far as environmental, we just attended our IEHA conference in Lawrenceburg, Indiana. That's a pretty big conference with all the local health departments that gather around. It was an okay conference this time. We came away with a little bit of information. Let's see what else we've had. We've had an uptick in lead cases. We're getting right now, it seems like we're doing around 2 a week right now as far as lead. So that's a little bit of an increase. And then we are coming off our busiest season of the year, just like vector control. All the fairs and festivals with food, because septics with the installs, and then with all the swimming pools being open, it's just our busiest time. So that's all I have. Not much. Any questions? Okay.
Thank you. All right, social services with Molly.
I don't have a ton today to share with you. We've still been progressing on our data collection, and I've added some new things to the report. And we've also, like Joni said, are working on more collaboration. This Friday, we've got the meeting to explain to the judges, prosecutors, and public defenders what we're doing in the jail, to work on building those relationships with them. And that's really all I have. Do you have any questions? Have you had a chance to look over the data? Yeah?
Yeah, thanks for all the additional data. The intake coordinator, so I looked at the data under that.
Yes.
A really interesting thing to call out there. So you did 261 total screens, correct?
Yes.
And of those 261, 142 of them had issues with food.
Yes.
And that's is number one, and then number two, substance abuse, number three is clothing.
Mm-hmm.
So I think that's some good information to call out.
I wanted to add something. Do you guys remember last year when I had talked about, you had asked what are some of the main needs that they need as they come out of jail? And one of the top ones that I had mentioned was clothing. And so Jeremy's been able to bridge that gap, and he's actually going to get up here and share some things with you if you're done with me.
Yeah.
Okay. This is Jeremy Baker, and you guys already know he's our intake coordinator.
Good evening. So first off, I'd like to say last time, I don't know if you guys remember, but we had presented you with a resource guide for the community. And so that was approved by the jail, and all the screenings I do, and then people that request to meet with me as well, they get the resource list. However, I always wanted everyone to be able to have access to the resource list in the community. And so what I was doing was like printing and folding hundreds of these and driving them around. And then finally, one of the ladies at Valley Professionals said, Jeremy, is there any way that you can have this on your website so we can just print it off whenever they want? And I thought that was an absolutely fantastic idea. So I met with Joni, and then we discussed that. And when we collaborated with Ms. Jackson and Tiffany, we got that on the website. And I just wanted to thank her, because now anybody can go to the health department's website and print this off, read it, whatever they need to get resources. So I thought that was really strong. For being the intake coordinator at the county jail, it's proved initially to be a little difficult because the population was not used to being asked if they needed help. So it took time to build rapport and a positive reputation with the inmates. So I felt a little defeated at first, but I knew it was going to take some time because only a handful of people reached out the first month, and then the next month it grew a little bit and a little bit. Well, then last month I had like 26 people, so every single day of the month almost somebody was calling me and asking for help. And I was like, so here we go. And then as of today, I've already got 15 that have called and needing food, clothing, food stamps. An individual that graduated the program needed clothes for their kids, different things like that, and I've been able to help them with all those resources. So very, very proud of the positive progress that's taken place, and it took a little time to get going, but we're seeing positive results, so I'm very, very pleased.
We sent the resource guide out to all users in the county, and wonderful feedback from the courts, from the probation office, other ones saying at the clerk's office, people come in looking for this information, so they were pretty pleased about it. And then we told them to disseminate it, and we sent it over to the mayor's office, encouraged them to utilize that also in their departments.
Yeah, as well as the fire department, I went and met with them, and the secretary there distributed it to all the houses, so that way they have the resource list for when people lose their apartments or whatever it may be in a fire. So,
And I may have missed it. Did you say police and sheriff's office?
so yeah, good stuff.
That's great. We know that
Can I-
40% of wellness comes from social determinants of health, so you're making a great impact in that.
Thank you, thank you.
And I'm looking at your data, you know, the goal is to keep people from going back, right, into jail.
Yes.
And help them, once they get out, or decrease the number of times they go back into jail, even if they reoffend in some way. And I see that you have some rearrest rates, which is good to look at. In terms of just informally, even when you see someone come back into jail and you meet with them again, does that happen sometimes?
Sometimes, yes.
Okay. Do you feel like the people that are actually engaging in your service have a tendency not to come back. I know that's very informal and not data-oriented, and you've got some data here. That is
Yeah.
kind of the goal, right, is to help them get what they need.
So I would,
decrease that.
I would say it's a fairly small number of the people that I've met with and then assisted hands-on that have returned to jail. There have been a few, but like offhand, I mean, I would say like maybe 5 or 6.
If they successfully complete the program, like
Yes.
6 months to a year, just looking at that. So there's a small amount that actually return in that time, is what, okay.
Yes.
I know that's what I'm just kind of interested in, is that impact on the jail population, getting people connected to resources so they don't.
And then I also, if they're having additional issues such as mental health or other issues like that, then I try to reach out to the individuals that work in the court system that work with mental health and refer them to them. So I don't always follow up with those same individuals, but try to find the resources of the people that would be able to help them best.
Great. Thank you for your work.
Yes, thank you. Any other questions? All right, thank you.
Thank you.
And just to add another caveat, the state Department of Health is wanting us to move to KPOs instead of KPIs. Well, sort of develop KPOs. So what's your main outcome? Like, we wouldn't want people to be rearrested or to make sure that their needs are met. But I just happen to be working on the one for trauma and injury prevention. I printed it up and you guys can pass it around, but I added a KPO on it, but you can see what some of the KPIs are. And Shelby and Andrew helped establish what the base numbers were. And in January, we'll be able to bring to you all the outcomes of our local KPIs, those that are funded by Health First Indiana, and then the ones we established off of our general health fund. We went ahead and established them for all the core services, even though most of them aren't done by HFI funding.
Right, Robin with the clinic?
And this is also on our website.
Hi. In reference to our last board meeting, we had our fall vaccine bash. It turned out wonderful. We saw 30 patients go through our clinic on a Saturday with a total of 43 vaccines given. The dental bus was also there seeing 7 children. They treated for cleanings, yearly cleanings, and preventative care. We can't wait for next year to make it bigger and better. I've handed out all of the board members a packet with some very impressive numbers. These numbers represent the efforts of all of our clinic staff that we have been working towards. We continue to keep our residents of Vigo and surrounding counties vaccinated. Also, this shows that we are entering the patient data in a timely manner into a system called CHIRP. And for those that don't know what CHIRP is, it is a web-based registry maintained by the Indiana Department of Health. It is designed to permanently store the immunization records for all Indiana residents in an electronic format. We visited Head Start and gave their staff their yearly TB test, and we did lead and hemoglobin testing on 46 preschoolers. So, the dentist bus was from a SMILES program from IU School of Dentistry. It was a really good thing for our vaccine bash, so I hope they'll come back next year. Is there any questions? No? All right, thank you.
For all your hard work. Great. Shelby?
She's had the plague, so bear with her.
Oh, you can see back there.
It's not the plague, it's just thanks to harvest season and all the allergies. So this past quarter, the Safe Sleep trailer has traveled around the county and surrounding communities. So we've been to the Park County National Night Out, the summer provider fair that was put on forth by Firefly, and that was down at the Vigo County Fairgrounds, the Brazil Community Baby Shower, the Vigo County Health Department Fall Vaccine Bash, as well as the Indiana State University and their nursing students. Going to all of these locations, we've kind of identified some different aspects that we need to add to the trailer to ensure safety. for everyone who comes onto the trailer, such as some steps by the door, maybe a better handle that assists them, as well as something that moves some air along. That trailer gets very, very hot on the inside. We currently have 45 doses of nasal Narcan, and I don't know if you are aware, but now there is a new product on the market, and it is a needleless epinephrine, which is very cool because I think it will help lessen the stigma that's associated with nasal Narcan. So you might see that on different shelves. I just saw a commercial pop up one day, and I was like, that is awesome. We have 30 wound care kits available. However, due to recent executive orders and some funding restrictions, the Indiana Department of Health is not able to supply certain harm reduction products any longer, and that includes the intravenous harm reduction kit as well as the smoking harm reduction kit. We don't have any of those. The state does not have any of those for me to order, and at this moment in time, I don't foresee when that may be reoccurring. Still up in the air. And then lastly, within this quarter, we have had 22 students throughout our Serve Safe exam. It's a very long day, and I want to thank Amanda Shook for partnering with me to do that. We can do that together, and it's a long day. It is a very long day in this room, and sometimes this room gets really, really warm. But we also solidified dates for 2026, so that will be up on our website and social media and around the annex as well. Any questions?
Some of the efforts that were done at a local nursing home, do we do that at all facilities, or was this by request?
Are you referencing Silver Birch?
Uh-huh.
Yeah, they reach out to me. One of their employees just happened to reach out. So now we have a rapport, and I go to them about once a month for different various topics. Our next topic is on breast cancer and something else that off the top of my head I'm blanking on. But for them, we will definitely continue on a monthly basis going into 2026, and I assure that other facilities will probably see us in the community and want similar activities as well. Brownstone Manor is on our quarterly one.
Any other questions for Shelby?
Thank you.
All right, vector control.
Good evening. Well, we sent in 6 bats, 2 cats, and 1 raccoon for rabies testing. All came back negative, so that's good. We filled a 4th semi-trailer with TARS, so that's 4 for this year again. We sent in 104 pools of mosquitoes. 18 pools of mosquitoes came back positive for West Nile virus.
Mike, how does that compare to years prior?
That's high. That is high. And again, it's because we had a dry season this year. Myself and Robin were talking about it before the meeting. I mean, I think we're like, it wasn't Robin, I'm sorry, it was Amber. I think we're like 4 inches below normal rainfall amount. Anytime you have less rain, the Culex and Aedes species, certain species of those, will breed in the stagnant water, and every mosquito has a different type of breeding spot that they like to breed in and lay their eggs in. And whenever it's dry, the water's stagnant, so that allows for more Culex breeding than any other time of the year. So we kind of knew it was going to be high, and what I did was I kind of got some numbers for Indiana and Illinois, just kind of so you can compare. Indiana, all 92 counties had West Nile positive pools. There wasn't a single county in the state of Indiana that did not have positive West Nile pools. And there was 803 positive pools in the state of Indiana. Illinois had 3,964 positive pools of mosquitoes coming out of 60 counties. Human cases in Indiana, we had 34 human cases this year. No deaths, but there was 34 humans that became infected with West Nile virus. Illinois had 119 human cases with 6 deaths. So Illinois came out a lot worse than what we did. But I think it's more of a rural area, and they do less vector control than what we do. So that's kind of the difference between the two states. But again, it was really because it was a dry summer. And anytime we have a dry summer, we're going to have large amounts of West Nile virus. Anybody have any questions? I'm sorry, Dr. Lynn, I couldn't hear you. Not that I'm aware of. Joni, is there? I mean, not that I'm aware of. Vaccination for West Nile virus? No. I wish there was. If you could come up with one, we'll market it. It differed from county to county. Some of the counties don't have vector control programs, so the state comes in and they do the testing in the county. So once they get one positive pool of mosquitoes, they move on to another county because they have, what is it, Joni, 4 or 5 interns, I'll call them interns, but that work for the state, and they divide the state up into different areas. And that intern goes to those counties in that area, and they will do West Nile virus testing themselves. Because like Vermilion County, Park County, they don't have vector control divisions. So any of the West Nile positive came from the state of Indiana. Their interns collected those mosquitoes themselves. Once they collect the mosquito from that county, they don't go back to that county. So it may read 1 per that county, but once it's in that county, it's like our county. We had, 18 pools, but that's because we keep collecting. Most counties, once they find it in their county, they don't collect anymore. So the numbers are less, but they still have West Nile in the county. That's the bottom line. All 92 counties had West Nile virus.
Dr. Lim. You need to turn it on.
When you have positivity on one area, do you maximize your fumigation in that area?
Yes, we do. We increase our larviciding and our adulticiding both. Some of the areas where we got our West Nile positive from are areas that are not accessible to the public. So we still go down in that area and we larvicide and we adulticide, but it's not really a health risk to the public. It's just an area that we know we can count on every year that's going to give us a reading on whether there's West Nile positive in our neighborhood or not, or in our community. And that's really what the program is about when you're talking about testing for mosquitoes, is once you get West Nile virus in your community, it's in your community. It doesn't matter whether it came from the north end, south end, west end, east. It's in the community, so everybody should be aware and be diligent when they're outside, wear insect repellent and take precautions.
I'm not too educated with the West Nile virus, but you have a positive mosquito infection in the West Nile with West Nile virus. It's a virus, right?
I'm sorry, Dr.
If you have, it's okay. If you have a positive West Nile virus on a mosquito, how does it propagate if he infected you as a human being? If another mosquito bit you, that mosquito gets virus, like in malaria?
Yes, it's just like West Nile virus, the bird is the carrier.
All right.
So the mosquito has to bite this infected bird. Once it bites the infected bird, then it can come and bite you. Then another mosquito can bite you, and the less it's possible that mosquito can become infected. Get it, and the West Nile virus from you. It's a lot of different ways of transmission.
public health problem when there's a lot of infected people, or what is it?
When we get to the point, that's why we do collections, we get to the point where all of our collections throughout the county, they would all come back positive. Then that's when Tony would know we were about to cut, and we should help. Advisory, because we have a major problem. But when it's isolated, it's not really a good problem.
And we have a three-prong approach using education, surveillance, and prevention. So the prevention would be the treating catch basins on parking lots, or our fogging program. Surveillance is the light traps where we go out and collect them from different areas within the county. And then, of course, education is probably the absolute most important, and that's telling people to get that standing water off of their property, and then fix screens, declog gutters, all that type of stuff.
Sorry about that, Doctor. In my hearing, it's going back to all the ULB machines. Anybody else have any questions? I'm sorry. All right, thank you.
Thank you, Mike. All right, Loretta, Vital Records.
I'm going to do Loretta's report. She had another obligation. Vital Records is still working with organizations on helping customers in need to get their birth records. And as the weather starts to change, we anticipate that we will be starting getting busier with people that are homeless and they're needing their records for the shelters that they stay in. And at this time, the county records are still, we're still deciding on raising the price for the out-of-county birth records and death records. We are in contact with the other health departments to see where they're going with that. And then during the holidays, we are going to bring back the college students, and they're going to work with the data entry to get our records put in. Any questions?
For the purposes of this report, what's a drug related? How do we define it as drug related?
Are you talking about when somebody puts on their death record? Is Brooke here? She's not here. Okay. Brooke's not here, but you're talking about when they enter a drug overdose?
I'm talking about this on the report. In April, we had 4 drug-related deaths. In May, there was 2.
Those would be overdose.
How does that compare to years prior? Is that?
To be honest, I'd have to go back and look at Brooke's records because she keeps all the records on that.
I think if you look at the state website, we have greatly decreased our
That's what
our efforts.
Yes.
Yes, it's actually a really nice map because we're light and the rest of the state is dark, which I don't feel happy for the rest of the state, but it really makes me feel like you all have done a lot of great work.
And Travis Norris, which is our county coroner, reached out, and there's a grant opportunity he wants to collaborate on, and it's looking at different ways we can do prevention with death. We do participate, and Shelby participates in all the fatality review teams, but it's looking at assessing where we think there are gaps in programming. And he thought about drowning prevention. Well, we already are doing a drowning prevention program. Then he said safe sleep, and we're like, okay, we've got a safe sleep trailer. So we're going to look at how we could best use that funding and develop an RFP.
I also want to touch base with you on that.
I just saw it on the next page. Yep.
You saw it?
If I had just flipped forward one more.
Okay,
Thank
and
you.
then about sometimes it's like if they pass away from, let's just say, a heart attack, but they use drugs, they'll also put that as a second.
Yes.
Yes.
Is there any citizens input?
I wanted to say that we made sure that the whole county website is ADA compliant, and Scott was working on that, and we're ensured that it is, and making sure that everything opens up the way it needs to be, and for those that have different disabilities, make sure it's accessible to them, so I was pleased about that. And then we've got the ribbon cutting on Friday at 6 o'clock at Griffin Bike Parks Education Center, and that's a wonderful opportunity for us to showcase some of our ways that we utilize HFI funding. Unfortunately, with a lot of the cuts, the nutrition educators at Purdue Extension were let go. And so Adam Grossman and I have had some conversation about seeing if that's something that Shelby could help fill the need, or who else we could go to do the health programming at the bike park.
Has the governmental shutdown impacted the operation?
It has not, thank goodness.
Anybody else have any other comments prior to? I have, the next board meeting will be January 21st. Can I have a motion to adjourn?
Make a motion.
All right. All those in favor?
Aye.
All right. Thank you very much for your time.
Thank you.